Several infectious diseases like the flu, bird flu, Ebola and polio are on the rise. And measles, which was once declared eliminated in many countries, has re-emerged with a number of cases, hospitalizations and even deaths. Experts say the current surge is due to international travel, pathogens and low vaccination rates. So how great is the risk to the global health system? I'm joined in the studio by Eric Feigl-Ding. He is an epidemiologist, health economist, and chair of the Department of Public Health at the New England Complex Systems Institute. The United States is seeing a surge in cases of measles. Now, this is a disease which the World Health Organization declared eliminated in 2000. That was 26 years ago. So why are we seeing this comeback?
You know, vaccination is the key, of course, but we live in an anti-vax era under an anti-vax administration in which appointed as his health secretary the king of anti-vaxxers. So this is one of those obvious conclusions of where we are now. Now, this outbreak, of course, is very unfortunate, and 95% of the people who are infected were unvaccinated or unknown vaccination status. 95% were vaccinated, only 5% unknown vaccination status. But of course, the CDC these days doesn't even point that out. They point out, oh, look at those who got vaccinated and still had a breakthrough infection. Not the fact that, you know, it was the other way around, that the vaccine levels have dropped. But public health is always, I remind people, it's not a pure science. Public health is policy. Policy is politics. And because we have of anti-vax politics, we have anti-vax policies, or policies that inherently water down any emphasis on getting your vaccinations. And with the CDC and all these other committees and HHS, we see this. That's the standing protocol. Yeah,
but Eric, in this case, it would seem to be a no-brainer. No vaccines, higher rates of disease. More vaccines, lower rates.
Yeah, but that would be the no-brainer. But the thing is, measles is so contagious, first of all, as Dr. Ziad has also pointed out, that vaccines are so important. But the pocket of America, even if we have, say, 95% vaccinated in a country or in a state, there will be pockets in which there are very, very low vaccination rates, well below the herd immunity threshold. And all it takes is a pocket of people who are low vaccinated for the measles to run wild. And unfortunately, our society is very polarized. A lot of conservative areas have very low vaccination rates for everything, not just measles, for COVID, for the flu shot, everything. They have very low vaccination rates. And all it takes is one spark to ignite an outbreak in many areas. And then domino effects out.
You were saying a moment ago that, you know, policy becomes politics, and we look at the politics and the ideology that Robert Kennedy brings to his job. He's been described as a vaccine critic, a vaccine, someone who doesn't believe in it. I mean, he fired the entire CDC Advisory Committee on Immunization Practices. What does that mean for the U.S. healthcare system?
Well, that was devastating. Basically, he cleared the entire scientific committee that recommends vaccines and vaccine schedules, and instead he replaced it with all his people who are loyalists to him, to say the least. And of course, most of the time they vote with him to give him approval. Actually, even recently for some of the vaccine schedules, he bypassed. It was so ridiculous, he even bypassed his own vaccine committee and instituted policy himself. I remind you, the CDC director that was Senate confirmed under Trump also was fired/resigned, forced out. And they don't actually have any CDC director. The acting one was, I think, a George W. Bush speechwriter with no medical background whatsoever. So he's now effectively playing king of all vaccines and taking over the role of the CDC and bypassing the CDC altogether, and in putting on the committee people who say, like, you know, vaccine efficacy is secondary. We're not really going to pay attention to that as much as vaccine harm. So they're inherently looking for reasons to dilute vaccines. And at the policy level, they have so much power. Not only did they defund billions of dollars in vaccine research, but now they also remove the guardrails that allows people to litigate and sue vaccine makers. And as a result, vaccine makers aren't going to make new vaccines in the future. That was a big announcement as well. So all these policy decisions are only going to fuel not only vaccine misinformation, vaccine distrust, but basically entirely tear down the U.S. vaccine and public health infrastructure to prevent infectious disease.
Yeah, and Eric, to what extent has this been driven by this presidential memorandum which was issued saying that U.S. vaccine policy has to align with Denmark?
Yeah, that was interesting. What they say, well, with peer countries, which interestingly, we're trying to invade Greenland or take over Greenland. So I'm not sure how long Denmark will remain a peer country at that point. But I want to point out other peer countries like Canada, UK, most of the rest of Europe, Germany, Spain, their vaccine schedules are what our CDC, former CDC, used to have. Yeah. Denmark was always the exception. And inherently, there's some sort of ties. Denmark's vaccine is very different than the rest. And Denmark is a very different country than the United States with universal health care, which the United States clearly does not have. And so for them to cherry pick that while ignoring the rest of Western Europe and Canada and other, peer countries in Asia is just, of course, ludicrous. They're just cherry picking to water down and dilute and weaken all vaccination protocols. And that's why I feel like American Academy of Pediatrics stepping up and, saying, doctors should follow the American Academy of Pediatrics, I think shows great leadership on that part. And as a result, of course, HHS is suing American Academy of Pediatrics. Yeah. But that's inherently the political, litigious world in which we live now.
Eric, of course, decisions that are made here in Washington affect the whole world, given the United States' position in the world. Well, the U.S. has decided that it's going to withdraw from the World Health Organization. It's not paying its dues. So what happens then to things like, global disease surveillance and, vaccine development around the world?
Yeah, it's very scary. The WHO has to go through a lot of the reforms, unfortunately, right now because of the cutbacks. The U.S. has already withdrawn, and the WHO budget is going to be something of what they have to solve. But the U.S. has also stripped USAID funding, has basically shut down the USAID, which does a lot of global health work previously. And many African countries and South Asian countries are heavily affected by this. And it's very sad and unfortunate that this had to be. I think the America First doctrine of Trump is literally, we don't give a care about the rest of the world. Yeah. And I think, if we want to have moral leadership in this world, if we're going to be seen as leaders in this world, America is no longer first in leadership of public health whatsoever. And I think we're now dragging the world down, if anything, because of Trump policies and RFK Jr. policies. And as Dr. Ziad pointed out, our medical research is endangered for the next generation. Yeah. Universities are being slashed because the NIH budgets are slashed, CDC, National Science Foundation. All of this, it's endangering our world now, and it's endangering our children's world in the future. And that's the saddest thing of all.